So the passive lengthening provocation tests of the plexus involves of lengthening provocation of peripheral nerves, the median nerve, the ulnar nerve, and the radial nerve, and we use these nerves mostly to test the roots and the spinal nerves, which are coming out from C4-5 to T1. So the idea of the testing is not to provoke till there is pain. It is a lengthening provocation to see in what way the muscles of the patient will react. Physiologically, everybody will react if you go very far. So don't try to do that, and just do it in a normal way related to person's age and mobility, and see if the reactions are very strong, very abrupt, and also see if you can provoke the pain for what reason the patient is coming. So first, if you test it, check if there are normal shoulders. I think she don't need a pillow, so we can do that. And we check the normal shoulder. We can do that bilaterally by doing this, and we see that there is an equal movement in close back position, so that's okay. We check if the elbow is normal, there's no too much hyperextension, and normal or a bit excessive wrist movement. So remember that when you test. So we go to a neutral position of the shoulder, fix with my hand the shoulder, and come to an abduction of 90 degrees. I hold the arm with my knee, and just in external rotation and supination we come to extension. So the test is extension of the elbow. Be careful by putting too much of distension. You don't need it. Certainly not in the beginning. The test is enough with slight extension of the wrist, without extension of the fingers, and just test the elbow. We already see here that we cannot extend fully. So it has no sense. I know if I do more tension on the fingers that I will have less extension of the elbow. But I'm not interested in stressing too much here. So just there. This is the extension of the elbow. Am I sure that if it is due to neural tissue? Yes, I think. Because if I make the lengthening of the neural tissue shorter, I see that I can extend the elbow, no problem. And I see if I make the way longer for the nerves, this is my extension, and she feels it. It's not pleasant, so we won't do that. So we come back to the neutral, and now this is perfect physiologically. If we test the median nerve by this way, 2-3 times, feeling how the end feel is, and it still is a bit tension, but it is elastic, which is normal. If it will be pathology, it would be a stop, a muscle spasm. Now we will go to the slump. And the slump means that you need a vertical sacrum and a totally flexed thoracolumbar spine. So we will do that. Put your hands without pressure there. And let it slump, let it go. Okay. We keep the sacrum vertical. And now we will see if we add more flexion in the head, if he has a problem, a pain problem. Is this? Do you have a problem? No. No tension. Okay. If you would have tension, then we would move the head upwards, only high cervical spine. and see if his findings are changing. So we bring back to maximum flexion, and we will ask to the normal side to bring in extension, and we feel the tension on this side, and we'll have a look at what happens here. So he comes to extension. Do you have a problem with that? Yes, and that is tension in the leg. Okay, but it's not painful. Okay. If I lift your head, can you go further? He can. And okay, we bring him back.